This is a great opportunity for us to expand our services in Kingsport. We have been here in this area with family medicine and internal medicine for quite a while, but this expansion allows us to bring really more horsepower to our infectious disease services up here, and something we've provided in Johnson City for many years under the leadership of Dr. Mormon and Dr. Pierce, and now allows us to expand and really provide services for Kingsport on a much more efficient manner for folks not having to travel to Johnson City any longer for the specialists of our infectious disease. We appreciate everybody's support, appreciate the support of the other practices in the region, both Holston Medical Group and SOFA and the Ballot Health Medical Associates, for really utilizing our infectious disease services to take the best care of their patients, and are excited about this opportunity.
I just remark at how beautiful this space is and welcome everybody here, and I wanted to recognize the faculty that are going to practice in this facility that are here today. And so that starts with Dr. Matthew Krolikowski, who is in the back, as well as Dr. Neethu Vedantam and Dr. Matt Finnis. And so they're going to practice here regularly, and so we're excited that they can be part of the new offerings that we have with the infectious disease, and also a new training site for our internal medicine residents, who have been nice to have a representative group that has come here today. Also, specific shout out to Dr. Lamis Ibrahim, who is the division chief of internal medicine and infectious disease, as well as Katie Flora, Angie Metcalf, and Amy Nelson, who were a big part of the project management for this. So it's been a team effort in all aspects, but really the vision that started this all was that of Dr. John Mormon.
In infectious diseases, we deal with a lot of kind of complicated and very scary diseases for patients. But when you are sick, you definitely want us around, and I think there are people in this room who could attest to that. So our vision for ETSU Infectious Diseases has always been to serve the entire Upper East Tennessee region. So with the unwavering support of President Noland and of Dean Block, we can finally say that we serve the entire region with a 24-hour day, 7-day-a-week service, coverage for infectious disease services, both inpatient and outpatient, and now in this beautiful site directly adjacent to one of our major clinical hospitals, we're able to really provide excellent care. Know that going forward, we're going to be here. Our division's going to be here. We're going to provide superb infectious disease services, HIV care services, wound care services, travelers medicine services, and education of the future clinicians who will be here in Sullivan County, here in Kingsport, for many, many years to come.
I grew up with a real appreciation for all the folks in the medical community, for the folks who cleaned up in the emergency room, to the physicians, to the nurses, to the technicians. It's just a great community. The expansion here and the dental clinic is coming along, and ETSU is a great partner in that. We just feel very fortunate in Kingsport that we're blessed with this high quality medical care, and ETSU has a lot to do with it.
We do appreciate the investment in this facility, and as we continue to expand our footprint here, it's just so important regionally, not just here in Kingsport, but as a regional project too, because this will provide health care for people in Southwest Virginia, down in Hawkins County, and multiple places across Northeast Tennessee here. So we do really appreciate what you do. You know, early detection in this, I think, would be certainly a priority for infectious disease. So thanks for letting us be here today, and just letting us be part of this big day, and we really do appreciate your investment.
Got it, Bree. All right, ready? 1, 2, 3, cut. There you go.
So this is like 3 times bigger than our Johnson City. It's so much nicer. Aren't you jealous of this one?
Yes.
It's so much bigger and so much better for our patients. Our lab in Johnson City is like this big. And David's so jealous.
Thank you so much.
So this is our nursing area. This was also not here. So we created this area, and we've got all the rooms off of here. The nurses are here almost 24/7, taking care of patients. So we have a team room, and actually this is where I will practice out of. So the team room is where we kind of all get together, and I will run a clinic out of here so that I can talk to my other providers if we want to run over cases together, if we want to discuss complicated cases, or if we're just trying to figure out the day-to-day what we need to do next with a patient. We're here in this room. Plus, it's a very bright room, and it's very open. Are you?